Hello guys, today we will see the MCQs, important MCQs in cardiology topic. First question, a patient with acute inferior wall MI develops sudden hypotension, clear lungs, raised JVP, jugular venous pressure. JVP means most likely cause. LV failure, RV infraction, papillary muscle rupture, cardiac tamponade. Answer is right ventricular infraction. Inferior MI often associated with right ventricular infraction, hypotension, raised JVP, clear lungs. Next question, drug of choice for atrial fibrillation with Wolff-Parkinson-White syndrome. Digoxin, verapamil, adenosine, procainamide. Answer is procainamide. ECG finding of hyperkalemia severe, prolonged QT, peak T wave, ST depression, U wave. We know peak T wave. Beck's triad is seen in MI, heart failure, cardiac tamponade, pulmonary embolism. Beck's triad is seen in cardiac tamponade, hypotension, JVP distension, muffled heart sounds. Three symptoms are called Beck's triad. Beck's triad is seen in cardiac tamponade. Most common cause of mitral regurgitation in India: rheumatic fever, MI, endocarditis, cardiomyopathy. Answer is rheumatic fever. Which drug reduce preload most? Dopamine, furosemide, nitroglycerin, digoxin. Answer is nitroglycerin. Nitrates works vasodilation. So it will reduce the preload. Next question, pulsus paradoxus is classically seen in asthma, cardiac tamponade, MI, aortic stenosis. Answer is cardiac tamponade. A patient with STEMI should receive thrombolysis within 2 hours, 6 hours, 12 hours, 24 hours. Answer is 12 hours. This 12 hours is called golden period. So, most common cause of sudden cardiac death in young athletes. So, MI, hypertrophic cardiomyopathy, dilated cardiomyopathy, myocarditis. Answer is hypertrophic and cardiomyopathy. Which condition gives water hammer pulse? Aortic stenosis, aortic regurgitation, mitral stenosis, MI. Answer is B, aortic regurgitation. Drug contraindicated in acute MI with bradycardia and hypotension. So, acute MI with bradycardia, hypertension. Aspirin, morphine, beta blockers, statins. Answer is C, beta blockers, because beta blockers is reduce the heart rate and blood pressure. So, already patient with bradycardia and hypertension, so we can't give the drug was contraindicated for acute MI with bradycardia and hypotension. S3 gallop is seen in normal in elderly, mitral stenosis, dilated cardiomyopathy, aortic stenosis. Answer is C, dilated cardiomyopathy. Most common arrhythmia after MI: VT, ventricular tachycardia, VF, ventricular fibrillation, AF, atrial fibrillation, sinus bradycardia. Answer is most common arrhythmia after MI is atrial fibrillation. Kussmaul sign is seen in LV failure, left ventricular failure, RV failure, right ventricular failure, cardiac tamponade, asthma. Kussmaul sign seen in B, RV failure. So JVP rises on inspiration. So RV failure. This is a Kussmaul sign. JVP size will be increased during inspiration. The condition is seen in right ventricular failure. Most common congenital heart diseases: TOF, ASD, VSD, PDA. So answer is VSD, ventricular septal defect. Most common congenital heart disease. Reverse splitting of S2 is seen in RBBB, LBBB, AST, MI. Answer is LBBB, left bundle branch block. A 58-year-old male with inferior wall MI suddenly becomes hypotensive after giving nitroglycerin. JVP. This question also, nitroglycerin very important complication is hypotension. JVP rises, lungs are clear. What is the most likely diagnosis? LV failure, cardiogenic shock, right ventricular infraction, pulmonary edema. We see in the previous question what are right ventricular infractions or symptoms are hypotension, JVP rise, and lungs are clear. So the here answer is right ventricular infraction. A 65-year-old patient after MI develops sudden acute pulmonary edema. After MI, acute pulmonary edema and new systolic murmur radiating to axilla. So, cause ventricular septal rupture, papillary muscle rupture, pericarditis, cardiomyopathy. Answer is B, papillary muscle rupture. After MI, post MI complication, one of the complication is papillary muscle rupture. So, in papillary muscle rupture, we have to see the symptoms of acute pulmonary edema and new systolic murmur radiating to axilla. And very important complication after MI is atrial fibrillation. A patient with severe asthma attack has drop in systolic BP during inspiration more than 10 mm Hg. What is this sign? A patient severe asthma, drop in systolic BP during inspiration more than 10. So what is this sign? Small sign, pulses alternance, pulses paradoxus, Waterhammer pulse. The answer is pulses paradoxus. A patient with chronic mitral stenosis develops irregular pulse, no P waves, narrow QRS. So irregular pulse, no P waves, narrow QRS is most likely rhythm. Ventricular tachycardia, atrial flutter, atrial fibrillation, junctional rhythm. Answer is atrial fibrillation. In cardiology, very important about ECG, image based question. They have shown the images of ECG. Then we will find the conditions is very important in NORCET. Here we see that is atrial fibrillation ECG. No absence of P waves, narrow QRS, and then irregular pulse.